Why is it very useful? Because in the biological nurturing position, the baby latches on much more easily with a deep attachment. So when we have those situations of attachment pain, of raggedies, or babies who have some contractures, who don't open their mouths well, obviously along with osteopathic work, we can try to insert an attachment, a breast position that facilitates a deep attachment. That is, that attachment in which the baby's mouth is open as much as possible and the mother's nipple is sent down so that it is stimulated as little as possible. It also increases stimulation, which means that milk drainage tends to be greater. What care should be taken when we have a seated attachment? The baby can be attached in the sitting position from day one, so it does not need to be a big baby. Of course, the attentions to be taken are different. We sit him, mom sitting, on one of the two legs in front of the breast we are going to offer. So we do a position change. Then the little puppy tells us how he prefers to be placed. If he is a little one who is still in the fetal position, we keep his little legs frog-like, so nice and flexed. If he's a little older who wants to stretch them out, he'll sit straddling, so like this, leggy this way, leggy that way, as we feel he's most comfortable. Let's bring your belly closer to his belly again, so that there is no space between you. He is sitting this way. You see how he is sitting. And so it also facilitates digestion and the passage of milk, especially in those cases of frequent regurgitation. This way he will be facing the breast. With one hand we always support the root of the neck, so we are going to support him back here. With the other hand we go for the breast, again just slightly back from the areola. The attentions to be kept are exactly those of the cradle position. So we bring Ambrose close, chin pivots, mother's nipple looks at the nose, because in doing so we wait for Ambrose to open his mouth wide. If he feels like attaching himself, little love, how good you are, what a job you do. Let's look again at the sucking movement that Ambrose is making, which is a movement that involves the whole joint all the way to the ear. In this position, I have to support the breast. So with your left hand, come and support. Very good, like this. And with your other hand, support his neck. The important thing is that Ambrose doesn't slip back, but we keep him well close to us. Two cautions. The chin in this position is perforce sunken into the breast. So basically, we don't even see the chin anymore. The mouth is definitely wide open. The little nose is free. Observe how he points it upward, okay? This position could also be made into a semi-prone position for the mother, so maybe even a little more comfortable. I lie down more and more, bed, couch, until I am semi-sitting and the puppy is prone, sucking on me, so he sucks on his stomach basically. The important thing is that the breast does not slip away from us. That is, he must not look down at the nipple. Otherwise, even if he takes well, it will slip away from his mouth, but he must always look in the direction of his mouth. Also observe his posture. The little head is hyperextended, the little nose is free, the chin sunken. This, guys, is the perfect attachment of the position in biological nurturing that you can use right away as soon as the puppy is born, and especially if you have discomfort at attachment, problems with raggades or babies not growing so well, because in this position we promote deep attachment and thus good breast drainage.